It is such a pleasure and honor to be here with each of you today and to see everyone's half faces. So for those of you who I know, it's good to see you again. And for those of you who I don't, I look forward to meeting you or maybe us being able to have some dialogue afterwards. So I've put together just a brief presentation today that will take you through where we are as a system with Ballad, and then some of the exciting new things that we're working on here in Kingsport and across our Northwest market. As Roger indicated, we have 8 facilities within our Northwest market, Holston Valley and Indian Path being the base for those hospitals here in Kingsport, and then we stretch up as far into Wise and Dickinson County in Southwest Virginia. We have Hawkins and Hancock County just to our west. So the Northwest market of Ballad really serves as we serve as a perimeter across our region for any of those facilities that are out there at our furthest lying points. So we're happy to be that base here in Kingsport and to support all of those because ours is most definitely the largest market across all of Ballad. So I'm proud to be able to support that. I will see if I can get this pulled back up. Is it on the screen here? Okay, perfect. All right, so I'm going to start out today with all of what's on the top of our minds, it seems every day for the past year at least. Just a little past that 1-year anniversary since we stood up our Incident Command Center to address all things related to COVID-19. So today I have some good news to share with you. Although we'll start by just going through what you may have seen most recently as our latest data that's come out this week in our scorecard. We have seen a bit of an uptick, and so we are concerned about that, but all of our hospitals stand ready to mitigate and respond as quickly as we need to. We have reestablished our Incident Command Center and the meetings that we have to assure that across the system we're well prepared, but our positivity rate has crept back up to right at 14%. And the latest data that I have here, which was through Wednesday, 127 patients in our hospitals, and that's the highest amount we've had since February. We peaked around 330 back in January and February, and then we have had a nice little lull where we had a low of about 75 patients in our hospitals, which was fantastic. And we anticipate that this volume will also go back down, and that's based on what we're seeing with the response to the vaccinations, and all of those that we are seeing come through now are in those categories that are 60 and below. So as we've opened it up now across both states for 16 and above, we anticipate that we'll see that come down even further. So to date, we are proud to say that as a system, we've provided 39,000 first doses of vaccinations and 33,000 second doses. So that's a total of 72,000 vaccinations that we've given across Appalachian Highlands. It is now again open to all community members. So I've listed this information up here for you. If you know of family or loved ones or friends who are interested, we do have the Vaccination Center open at our local campus at Indian Path. It is open 2 to 8 p.m. Monday through Thursday, and again 8 to noon on Fridays. You can schedule an appointment by calling the number on the screen or going to balladhealth.org, and we'll be happy to get you in just as quickly as possible for those first doses. It is important to note, though, where you receive your first dose is where you'll go back for your second dose as well. So just always note that, and anybody that you share it with. And I hope that many of you have at least had an opportunity to think about it. If you haven't already had the vaccination, I had mine and had very little, if any, side effects, none on the first dose, very mild side effects on the second dose. And my background and degree is in public health, so I certainly am aware of epidemiology and the studies of vaccinations and feel very confident with the vaccines that we have and the research that's been given. And I kind of looked at this from a personal perspective of I would rather know the common or potential side effects from the vaccination versus the unknowns and the effects that you could possibly have from having COVID itself. So this is probably one of the most exciting advancements that we've had, aside from the vaccine, is we have, just as of this week, opened our post-COVID care clinic. And I'm very pleased to say that that clinic is based right here in Kingsport. It is led by Dr. Paul Jett and his team. He is a physiatrist that practices here across our Northwest Market in our Spine and Rehab Center. So this is a brand new, innovative approach to address the after effects that many of our patients are seeing, those longer term effects from COVID. Once they pass the symptom onset, once they pass that disease progression and any hospitalization, some of the long-term lasting side effects that can occur are now being addressed. It is operated currently as a virtual care model. We do have a navigator that walks each patient through to determine and decide what course of treatment or what elements of treatment would be necessary, and to assure that we have all the range of services available, specifically related to pulmonary rehabilitation, getting that lung strength back, behavioral health. There's been a lot of cognitive issues associated with it. Simple things such as forgetfulness, but also as extreme as some PTSD and some of the things that our patients have experienced. Cardiovascular care has also been very important because, as you all are aware, and what COVID has done to the vascular compromise for so many patients. And then also just local support groups, because it is important to also note that everyone has experienced something different, it feels like. And those patients that we've seen and treated, whether it be in an outpatient clinic setting, coming into the emergency department, receiving the monoclonal antibody infusions, or those that have ended up on the ventilator and proned, which is the last resort efforts that we have. But we have had several of those that we've had great success with at all, well, nearly all at those levels, and unfortunately a small percentage that did not make it, but certainly important to note. Everyone's experience, though, is very different. And we are also, as we monitor this data, it's very concerning, I don't think surprising, but our total number of people as of last week that have tested positive was 92,000. And of those that do test positive, it's anticipated that about 10% of those will end up developing some sort of post-COVID syndrome. And that's not just for those in advanced stage, that's at all ages across the spectrum that we've actually seen that, from as early as an adolescent all the way up to those in their 90s. So this just goes over a little bit about what the Center for Post-COVID Care will do, and all of the symptoms that it that could be expected to linger following the disease process. Behavioral health issues, I did mention the PTSD. Also with that has come insomnia, anxiety, and depression, chronic fatigue, a lasting fever that you just can't seem to get rid of that will go away for a few days and then come back. Some ongoing GI symptoms or joint pain, impaired renal function. The memory loss and mood issues have been quite significant, and we think that's just been the traumatic process that many have gone through. And then again, the myocardial injury and what this does to our vascular systems. The pulmonary residual, the vision problems, and then just overall weakness and poor endurance. And many of our patients that have had the weakness and poor endurance have been those that have been very well and healthy in their 30s and 40s that run daily or many times a week, that have just had those 3 to 6 month lingering side effects of just not feeling quite like themselves. So we are very hopeful that this new initiative, based on very strong research and recommendations from a national and international perspective, and the level of treatment that we're able to provide, will help minimize those lingering results. So if you know of someone who is still suffering or having those lingering effects, please reach out. All the information is on balladhealth.org of how you can get connected. And again, it's based right here locally in Kingsport, which we're proud to do for our entire system. So I want to talk through some of our system updates. There's a lot of detail and information on these slides, and a lot of this information has come from our press releases that you may have seen, or if you're still watching, we've just reinstated our press conferences that we hold weekly that Eric Deaton provides those weekly updates for. But the most exciting that we have right now is with our children's network and the Niswonger Children's Network for Ballad Health. We recently unveiled a pretty substantial philanthropic investment into a comprehensive regional care system and model that will provide $60 million in funding and commitment to the children, families, and the future of our Appalachian Highlands. This will particularly serve those within our region here in our Northwest Market and Kingsport, in addition to the expansion that's occurring at our Children's Hospital in Johnson City and the new innovative modernistic care that's being provided at the NICU there. We also are developing our very own pediatric emergency room at Indian Path Community Hospital, and we're really excited about that. As many of you will recall, and you will see as I go on further into my presentation, Indian Path is now our Kingsport Center for Women's and Children's Health, and so we're really excited about this expansion so that the children here in our area will have their very own emergency department that they can go to with a higher level of care and attention that's supported just for them. Also, I think important to note is specifically for some of those counties and areas outside of our direct Kingsport community and those that are in a more underserved population, we have additional virtual urgent cares that will now be school-based. So children in those more underserved areas and without that immediate access to a pediatrician will have this locally within the school systems. And we're very excited about that and the partnership that we have. We've also branched out and expanded our pediatric surgical services. So in our partnership with ETSU Health, we've been able to recruit and retain 2 more trauma-capable pediatric surgeons for a total of 3 now that are based in Johnson City. So they operate there in the Children's Hospital. I've gotten to meet those as they've come on board and very excited for what they bring in that level of care for our community. And then also an investment into the Virginia Kids Belong, which will also service a significant portion of our pediatric population here in our Northwest Market. And that's a relationship between Niswonger and a proven program to assist with the development and sustainability of our foster families in Southwest Virginia. So much needed there for that level of support. And then, as you all are aware, we have the Kingsport Miracle Field here. So as a part of this, we also have a commitment of $250,000 that will be invested in access to activity and programs for our children here locally in Kingsport. So we're very excited about that. And then I'm going to go into a little more detail about this next topic, and that's called Strong Starts. Strong Futures and Strong Starts is what you may have also heard about the most here of late in the news. But that's a region-wide program that is a holistic approach to maternity care, early childhood development, and family support. So this is a new niche service and a new innovative approach to how we will address that whole continuum of care from birth on through adolescence, also to include the parenting aspect of it. So I know there's a lot of words on here. I try not to have too many words on a slide, but a lot of this has very important and good detail, and much of which you may have read about or seen online as we've introduced the program. But essentially our Strong Futures program is what is now housed in what was formerly Tacoma Regional Hospital. So in Greene County, we had the 2 hospitals. We had Tacoma Regional and Laughlin Memorial. They have merged into one location, which is now called Greene County Hospital East, GCHE. I'm glad that's not in my market because I'm pretty sure I would get that confused quite a bit. But they actually have developed Tacoma Regional into a women's and children's focused facility. And the primary goal of that facility is to take in and to foster those women who have had or currently experiencing drug addictive issues or related concerns, and being able to provide them and their children, whether born or unborn, that strongest possible start for them to be healthy and to have a sense of renewal and renewed spirit, and to be able to partner and align with us to assure that that child, as well as the mother, have the best start possible. We've also received a 2-year, $7 million grant that's been funded through the Tennessee Department of Human Services to assist with that and to assure that we maintain the program as it should be. And this just goes into a little more detail to break out what those services look like. And these, again, even though it's based in Greene County, it's available across our region, and we have referral methods in place so that we can be sure to align the patients, the mothers and the children, to the appropriate resources. But it will cover anything from child counseling, daycare services, financial stability counseling, the health and well-being, marriage counseling, any sort of parenting skills and education components that the mother or father might need, as it also is available for all of those that are involved and responsible for the care of the child. So very excited about this and that extension of care from our Niswangers Children's Network. And then some exciting news that is specific to our market. As many of you may recall, our Lee County Hospital unfortunately closed a few years ago, and we have been working with the Virginia Health Authority to assure that we were able to reopen this facility. And it's very exciting. I was actually there 2 weeks ago to tour the facility, and we actually have renovated the entire first floor main level entrance of the facility to now have it will have a fully functioning emergency department with 10 ED rooms and 2 observation rooms. It will go back with 6 inpatient rooms and 2 observation rooms, and then also have the full array of services to support the ED and the inpatient setting, to include cardiopulmonary, lab, telemedicine, as well as all imaging and diagnostics. So we're very pleased that as Ballad, we were able to open this facility back up, and this will be our 9th facility in the Northwest market. So this facility will also come into Kingsport for any of those additional higher level needs that the patients in that community might need. So our grand opening for that is slated for July 1. We are nearing the final stages of the construction, and then of course we go through our licensing and certification so that we'll be prepared by July 1. But very exciting for what this means in returning to that community with a fully functional hospital. So now let's talk about the exciting things happening in Kingsport. Our goal in Kingsport and our strategic plan is to focus on 3 really exciting opportunities that will cover an array of services, and those are related to growth, new technology, and recruitment. And as many of you may be aware, and as you've also read over the past 2 to 3 years, and as you know, all of what we've experienced in Kingsport has been a bit different. And we're excited, though, with the opportunities that it has opened up for us. And it has given us an ability to truly work with and engage with our community leaders, business professionals, doctors, retired doctors, our own frontline team members, to be able to really establish a vision for what the Kingsport community will be and how we will function and provide the best available care to all of our communities. So we have had in place a visioning committee for the city of Kingsport that not only focuses on Holston Valley and Indian Path, and merging those 2 facilities together. I've been there since the very first day and have worked very closely with both, and it has certainly been I'm not going to say a challenge, but more so an opportunity for us to really step back and to look at the best of both worlds. And that's what we've been able to do through the support and guidance of our visioning committee. So this has been a formal committee of the board, so of the Ballad board, for the purpose of making recommendations for the long-term strategy for our city and the healthcare that we will provide. So they do have a vision statement, and this committee's been in place for 2+ years. They've worked very closely with one another But it is to embrace the Kingsport spirit that embodies the relentless enthusiasm of its residents. The Kingsport Visioning Committee brings forth its vision for healthcare provision in the Kingsport market. And this vision and its associated signature program recommendations is built on the foundational values of improving our clinical excellence across the region, recapturing our identity and purpose for the Kingsport market, contributing a sense of pride for the community and its members, and fortifying Kingsport's belonging and contribution to the betterment of the overall organization. The Kingsport vision is presented in support of the Ballad Health vision to build a legacy of superior health by listening to and caring for those we serve. And I think it's really important as we think about all of those points in that vision statement and all of what this committee has worked tirelessly on over the past 2+ years, when we think about what we've looked like before and we think about all of the efforts that's gone into this to actually show how we can better align and support each other. And I've had to do it myself on the front lines. I was responsible for the initial merging of the 2 facilities across the community for surgical services. And it looks a bit different now than it did. We had orthopedics and neurosurgery at Indian Path. We had everything at both facilities. And in the first 1.5 years of us being merged, we were able to consolidate those higher acuity, more complex cases of ortho and neuro procedures into Holston Valley, which then has opened up and had much easier access for those shorter, more ambulatory cases at Indian Path. It is a much easier access for those patients who have an hour or less procedure to go there and have it done versus coming into Holston Valley. I mean, some days we might spend an hour finding a parking spot. But and that's been our purpose, is to identify and working alongside our visioning committee what the community is telling us and what it is that our community needs so that we can be better prepared and providing that support. So these are the members of our visioning committee. Some of the names you might very well recognize, but we have Julie Bennett, who serves as the chair. She is the VP and General Counsel for Bristol Motor Speedway. Julie has been a long-time board member for Legacy Wellmont, has served as the chair in multiple committees as well in capacities, so very much with a heart for our city, and really has been instrumental and very effective in leading this committee to get us to where we are today. And then, as you can see, several others: Terry Begley, Dr. Jerry Blackwell, Dr. Tom Brock, Marvin Cameron, Dorothy Dobbins, Suzanne Eller. Suzanne is a frontline pediatric nurse who made the transition from Holston Valley to Indian Path and has done so very nicely and held that program together. Bob Feathers, Colette George, Misty Kimbler, who is a frontline urology nurse at Indian Path. She's been instrumental in this as well, and telling us from not only a frontline team member's perspective, but also in the patients that she cares for there in the operating room. C.G. McCord, Roger Moen, Dr. Narayan, Dennis Phillips, Dr. Springer, Rick Tomlinson, Marta Waite, and Keith Wilson. So as you can see, we've got several community leaders and members of this committee that you all, I know, have a great deal of trust and respect for, and knowing that they are leading our city and developing what these niche services and true fulfillment of community needs are here in Kingsport for Ballad Health. So this is the first initiative to actually come out of the Visioning Committee, and that is the establishment of our Center for Women's and Babies and our Pediatric Emergency Department at Indian Path Community Hospital. As many of you may recall, this sped up a little bit when COVID hit, because there again, we were operating at both facilities, Holston Valley and Indian Path, in delivery of babies, and with a nursery at each facility too. So last April, we were able to consolidate into one facility, one location, and that chosen facility and location, based on the direction and the input received through and by the Visioning Committee, for it to be established at Indian Path. So since then, we've worked with the committee as well as our Ballad Health Board, and we have been approved for more than $8 million for a project of renovation and redesign for the birthing center at Indian Path. And we're very excited about this. Indian Path's birthing center has not had any sort of renovation since the 90s. So this will be something that our new mothers will have access to, that will be truly state-of-the-art and a center of excellence for delivery of that care, not just here in Kingsport, but it will be the newest and the best across our region. So again, we're really excited about this being here and a niche service for us. We will also have a comprehensive breast center, geriatric services, and gynecology services based out of Indian Path. Again, we've got duplication still across the city, so this will drive it to one location. And sometimes people often ask, what's the purpose? If it's functioning well at both locations, what is our purpose for having it then consolidating into one? It's not just about the efficiencies that are gained from it, but it's about the outcomes and it's about the quality. And the more volume and the more expertise and the more experienced physicians and providers that you have working collegially beside each other day in and day out will also help bring and generate what we feel to be improved outcomes and developing those center of excellence targets. And then also, of course, it will seamlessly link our patients to our Niswonger Children's Network and again, allowing for that better access to care. And then another exciting new feature in Kingsport is not really so new, but it is in some ways, and that's our established growth and development of our orthopedic and neurosurgery service lines. We've always done orthopedics, we've always done total joints, we've always done neurosurgery, whether it be brain or spine, and we're continuing on that path, but under some new leadership, we have carved out and developed an actual service line director role. Previously, orthopedics and neurosurgery have just rolled up under various different structures across our organization. We've had them as the surgical component through our operating room director, from a radiology perspective through our radiology director. So now we have one identified director that leads these two service lines to assure that we are meeting our quality metrics and targets, that we are pushing forward to develop our centers of excellence for each of these. We perform over 1,000 total joints here within our hospital at Holston Valley on an annual basis, and that's still on track and projected to be right at or beyond for this year, even though we paused on surgical operations twice in the midst of COVID. We're still on track, and we're working through those patients who have been waiting to get them back in for their total joints or their elective procedures. But it really is a focused, very strategic approach across our entire market, and working with our outlying providers and those surgeons and referral network to assure, again, that we have the services needed that branch out across all of the counties that we cover, but that we have what we would consider to be those niche elective services here in Kingsport. And we do have the latest advancements in technology. I'll talk about one in just a second. So we're excited again to be leaders, not just here in our market, but across our region, and that we're able to provide those higher levels of care here locally. And another exciting component for both orthopedic and neurosurgery is our continuum of care that we've established as we've onboarded our director, and that's really from the patient and consumer's perspective of being able to offer those prehab services in advance or preparation of you having the actual surgical procedure, and then following that up with that expected outpatient rehab. So really some nice benefit to being able to provide to our community those services on that continuum of care. So this is our latest addition at Holston Valley, and some of you may have heard of the Mako. The Mako robotic system is utilized in orthopedic joint replacement. So this new technology we have now at Holston Valley, Bristol Regional, and Johnson City Medical Center. We've had it just a few months in place now. It is a CT-based and guided navigational system that you would, in advance of your robotic knee, you would have your CT scans done, and then the provider, of course, has them available. But this provides a level of precision that allows for a much more precise fit and function of the knee replacement. And so we're very excited. All of our orthopedic groups here in town are participating, and we are looking to advance this with additional marketing within the next 1 to 2 months. Now that we are past our COVID pause on surgical elective procedures, we anticipate that we will have an increase in volume as we head into the summer months, and especially in the fall as patients are nearing that end of meeting their deductible. So we're really ramping up to be able to provide this, and knowing that it's just a great new feature and technology, and really puts us up there at the top of where we should be in being a center of excellence. And then I will end with just a few notes on our cardiovascular research. Many of you may know or have heard of Dr. Chris Metzger. Dr. Metzger is well known to Kingsport. He is well known across our region. He is also very well known internationally. And at Holston Valley, we have been pleased to present alongside Dr. Metzger as he takes his wealth of knowledge and experience across the world and actually live streams out of our Holston Valley Cath Lab for procedures that are being taught across the world. And you may have heard of LINC. LINC is the forum in which he presents this new technology and information. He really is a pioneer in the cardiac world, and really is very impressive in all that he does. He's widely published, has participated, and really been the principal investigator of more than 100 clinical studies. And you all, I know, have known this for years of what Holston Valley is and as being the heart hospital across our region. Dr. Chris Metzger and all that he does now, not just here locally, but across the world, has really put Kingsport on the map from a cardiac perspective. We were a top 50 cardiovascular hospital last year, in pursuit of that again this year, and that was not anything that we applied for. That was recognized based on our clinical quality outcomes and the indicators that we are responsible for the Centers for Medicare and Medicaid every day. So we're very pleased with all of what he's done. And his latest is through Inspire MD, and they're the developer of the C-Guard embolic prevention system. So that actually is used as a stent placement for the prevention of stroke that could be caused by carotid artery disease. So we're very pleased that this level of research is occurring right up the street from us on a daily basis. And this is just, I know that picture didn't come across very well, but this is also just another example of what Dr. Metzger has done in being able to use the first shockwave intravascular lithotripsy, or IVL system, for treatment of severely calcified coronary artery plaques. So very pleased with all of this and the outcomes that Dr. Metzger experiences every day. And then this is an eye chart, but this is what I will finish up with. So as you will recall, our 3 focus topics for Kingsport are growth, technology, and recruitment. So we're very pleased. These are just the doctors that have officially signed for this year that we're in right now. And we have a list probably twice this long for those that we're working with through the recruitment and the LOI process to get them to full signing. But to go down this list, we have 4 for cardiovascular services. One of those is a new cardiothoracic surgeon that we're very excited about, a female surgeon that's coming to us that will round out and provide us with 3 cardiothoracic surgeons right here at Holston Valley. We've been with Dr. Carter and Dr. Gall for many years now. It's just having the 2 in the practice. So adding this 3rd, and especially being a female surgeon, we're all very excited about bringing on Dr. Zhao. And then we also have a new oncologist joining us at our Indian Path campus for our regional cancer center. We have new family medicine, internal medicine that is also joining us. We have several primary care providers that are in the process of signing and onboarding with us, some starting as early as July, and we know that primary care and internal medicine is certainly a need across the city and across our region. And then, as you'll see, we have 4 OBGYN physicians that are joining us, and this is part of our laborist model at Indian Path, so that we always have a laboring provider in the building 24/7 to provide that extra layer of support and service for our OBGYN surgeons who also practice on an outpatient setting as well as in the ORs. So that's a great addition to our model. And then our 3 trauma surgeons. We're really excited about our 3 trauma surgeons who have rounded out our level 3 trauma program here at Holston Valley. So when we downgraded from a level 1 to a level 3 trauma center, we we've started from scratch with our recruitment and replacement of a couple of the providers that we lost during that transition, but now we have full coverage with full-time trauma surgeons 24/7. They're a great group of individuals, and I'm also pleased to say that of all the traumas that come into us and that are within our region and our market, less than 7% transfer out from Holston Valley. And those that do transfer out are the very complex orthopedic, pelvic crush fractures, acetabular fractures, those that really do need to be at that higher level of trauma center designation, but otherwise really pleased that we've maintained our status and kept all of our trauma here locally and are here to serve whatever walks through our door. So I will finish with that and just ask if there are any questions. I know I had a lot to present, so